So to see clearly, light coming from objects have to get focused onto your retina. This is done by the cornea, that's the clear part of the front of the eye, and your natural lens. Both of these work together to form a clear image on your retina. So if you're normal sighted, the cornea and the lens together will focus the light on your retina and you'll be able to see clearly. However, if you're short-sighted or long-sighted, the combination of the two does not focus the light on your retina. If you're short-sighted, light will get focused in front of your retina, and if you're long-sighted, it will get focused behind your retina. So refractive surgery is aimed to alter your refractive state by altering the anatomy of the eye. So we can either change the curvature of your cornea or the power of your lens, or put an additional lens into your eye to enable you to focus clearly onto the retina. So this is refractive surgery. So there are three types of refractive surgery that is in common practice. One is corneal refractive surgery, or we commonly call it laser refractive surgery, where we change the curvature of the cornea. Then there is lens exchange surgery, or what we call refractive lens exchange, where we remove your natural lens and put an artificial lens into its place. Thirdly, we can put a lens into your eye keeping your natural lens in place. So these are the three main types of refractive surgery. So that's a very broad question. The type of refractive surgery will depend on a number of factors. Importantly, age. If you are under 40, then the best options for you would be laser refractive surgery, that is surgery on the cornea, or a lens implant into your eye. If you're under 40, it's not ideal to take your natural lens out because you lose what we call accommodation, that is the ability to see near and distance at the same time. If you're older, if you're in your 60s, 70s, then there's not much point in operating on your cornea because your lens will form a cataract soon and it will need to come out. So in the older population, it's better to do a lens extraction surgery. So no surgical procedure is 100%. I tell all my patients that nothing in life is 100%. If you cross the road, there's a 99.9 or even a higher percentage chance that you will cross the road as you expected. But there's that very small risk that you may meet with an accident. That accident can either kill you or it can bruise you. And between those two extremes, there's a number of things that could happen. Some are less serious than others, but the potential to have complications are there. So sight-threatening complications following refractive surgery is rare, but there's a potential for it. And in the worst situation, you can lose vision or you can be worse off than you were before surgery. However, this is quite rare. So majority of the time, everything goes according to plan. Majority of the complications can also be treated successfully. However, in a very small percentage, you may not achieve what you wanted to achieve.